Hey everybody, today is Tuesday, July 16th, I think. It's my second day teaching. Hi kitty, come on up. You coming up here? Come on. I just got home and my feline children are playing outside, so I came out to do some grounding work. And if you don't know what that is, let me give my best effort at describing it. From what I know, which is not a whole lot, but to my understanding, grounding work is when you literally put your feet outside on the earth. And I don't know where I read it. I don't know if it's true or not, but I am choosing to believe the things that I read on Facebook sometimes are true. And this is what I learned about grounding. When you put your feet on the ground and feel the earth, apparently it like restores the cells in your body and heals you. And so yeah, I need to do more of that because I don't do enough of it. I don't really like to be barefooted. Have super sensitive feet, and I just really like shoes and socks. So but I also have been having like pain in my hip, and so if grounding can help heal it, then worth a shot, right? So anyway, plus lots of evidence says that more time outdoors is really healthy for you. And so I have not been getting outdoors a whole lot because I've been working a bunch between my nursing job at the hospital and then my new role as a college instructor. So I've been spending a lot of time indoors in front of my computer and not getting enough outdoor space. So I'm out here. I wanted to do this video. I watched a video last night of my buddy Pete Bland, who he did like a video journal kind of thing about his time paddling on Gore Canyon, which is a class 5 river that is difficult, and he never thought he would like be paddling it at this age. And anyway, his video was like so much better than mine always are. Like his video was on point. It was so good. Like he had this excellent, very clear intro, and then he continued with this amazing video of him, this like eagle-eye view of him paddling this class 5 river, and it was just like an incredible video. And now I am thinking to myself like, oh my gosh, like I want my videos to be like that, but I don't really know how to do that. So right now you're just gonna get what I have, and it's me. And I choose to show my face because I like to, I'm animated, and I like for you guys to see it as if I was talking to you. And hopefully I would not be, looking away all the time. But if I was trying to have like a very thoughtful conversation about something difficult, then I probably would be looking away so that I can like gather my thoughts, or it might take me a long time to like finish a sentence or whatever. Anyway, so this is what I'm doing. So bear with me. One day I will get better at these. I really hate the glare on these glasses, but I can't see the screen. And I don't like looking at blurry things, so I'm wearing them, and you're the one that's gonna have to suffer with the glare on the glasses. Let's see. So yes, today was my second day teaching at Carrington College for the nursing program. They have a practical nurse program, a PN, LPN to RN bridge program, as well as a BSN program. I think that one's online, but the other two are on campus. And Carrington is actually part of a bigger network of colleges called the San Johan Valley, I believe. And we have campuses in, I think, 7 states, and for a variety of different educations. So and the states, the cities, the different campuses, they vary. Like the programs that they carry and teach, they vary by location. At our facility, we have a massage therapy program, as well as a dental assistant program, and then the nursing programs. I think we're looking to add another program hopefully soon. We might also have a pharmacy tech program, but I can't remember. So I just want to give that recap because I haven't really told you. So anyway, I was originally, and I created a video about this last week, but it's really long and I've just been too busy to post it. So you're picking up at week 2. I've been there a little over a month, and last week was our first week for our new students. And I was originally slated to be a co-teacher for a medication administration course for brand new practical nurse students. And so I had my first week last week, and I got to teach more than I expected to get to teach. So that was a nice introduction. And then later in the week, it was the person so we are still trying to build our staff for our program. And so we are currently still looking to fill some clinical spots. And so one of our clinical instructors, who I was teaching with, and who was, working on building the course and getting all the content loaded into the learning management system, she was doing clinicals already, and we needed her in more clinicals. So they asked her if she would be willing to give up her lecture and lab that I was teaching with her, and spend more time in clinicals. So she agreed, and so that happened on last Thursday. So our first class was last Tuesday for week 1, and then on Thursday they had the conversations about what our needs were and what our resources were. And on Friday, I was informed that I would be the primary instructor for this class. That's a huge responsibility. And while it is incredibly exciting, it's also slightly terrifying. So I definitely had a panic attack on Saturday. I had a migraine for several days and literally slept a lot because my head hurt so bad. And then I had a panic attack while I absorbed it. So I guess I found out on Friday and then slept the whole rest of the day. I just couldn't, I couldn't, till the evening. And then I decided to okay, you need to get to work because your first class is Tuesday and you have a lot of work to do. So I did work a little bit that evening, and then on Saturday I had a panic attack and I had to call the dean, and I was like, oh my gosh, are you sure she doesn't want to do this? She doesn't want to be part of this class. Are you sure? I knew this was a possibility, but I didn't realize it would happen so quickly, and that the change of hands would happen so quickly, because I had not really had a lot of involvement in the curriculum, creation, and had not had very much involvement in the schedule and stuff like that. And I've never taught before, and so to be responsible for, the education of 12 adult learners in a program that, they sit for a national board for at the end of their program to get a professional certification. Like, it's a big deal. And so I literally had a panic attack, and I was like crying and like, I'm sorry. I'm just like, holy crap, like, oh my God, is this really happening? Like, can I do this? And I felt so much better when our dean agreed, I'm like, what are my resources? Do I have any resources? And she offered to, like, come and teach with me until I felt comfortable to teach on my own. And since that happened on Friday and my class was on Tuesday, and I had to work a 12-hour shift on Sunday and then a 10-hour shift until 9 p.m. last night, Monday, and my class was at 10 a.m. this morning, she offered to teach today's class. We had some content for it, like we had a PowerPoint, and we had some, I had already posted some things for them to do and stuff. So we had content for lab, for lecture and lab. And so, she offered to come in and show me kind of what she wants, like how her expectations are incredibly high. She's amazing. She's a new dean to our college. And her experience is incredible. And she's been a consultant for other, nursing programs, and usually RN programs versus PN programs, practical nurse. And she's written, test questions for like the NCLEX. And so she has really high expectations. Like, my expectations are really high because in my nursing program, their expectations were super high. Like, we didn't learn just to be nurses, right? Like, just, nurses. Like, we learned that if we were going to be a nurse, we needed to think like a critical care nurse or like a doctor, but you can't practice as a doctor, but still you're expected to think like that, right? And so my expectations of myself are super high. Therefore, my expectations of my students are super high, because I know that I'm going to try to deliver the same quality education that I received, right? Like, and I may, fail at some of my expectations. Like, I may not get it right all the time. And I have to be okay with that, right? And work towards improvement. So anyway, she offered to come in and lead the class today. And so she did. She created a pre-test for them, that we didn't, like a lecture test, right? But we didn't grade it. And then they have this test that they have to pass with 100% before it's called the MAPE test. It's the medication administration proficiency exam, and they have 3 attempts to pass it with a 100%. And if they do not pass it with 100%, then they have to sit out a semester, because they can't pass meds at clinicals. They're not allowed to administer medications if they don't pass with 100%. And so, part of my curriculum for that class is to help them pass the MAPE exam. That's a huge responsibility. Thank God I had amazing educators. Thank you, Faulkner State, that is now Coastal Community College, and Dr. Dukes, who taught my pharmacology class and also my, the dosage calculation classes. She's been a huge resource for me, and she, gave me this packet of 25-page packet of math questions that we as students had to complete, and she gave that to me so that I could share it with my students for practice, and because it helped me tremendously. So thank you, Dr. Dukes. You're amazing. I feel so grateful to have you as a mentor, and just wow, you're amazing. Your whole team, everybody at that college was amazing and left such an imprint on me as a nurse and as a professional, from the way I dress when I go to class, the way I speak, the expectations I have for myself, the expectations I have for my, the care that I give to my patients, and the expectations that I am, now carrying over to share with my students. So thank you for providing me with the tools that I needed to be successful in whatever I do as a nurse. So thank you. So going back, yeah, we co-taught that class together today, and it was great. It was great. we both taught. They took a test. They took a MAPE. They took the MAPE practice test today, and they haven't even learned dosage cal yet. And then I stayed over because a couple people weren't quite getting it because it's all brand new. They haven't even learned it. They have a whole dosage cal class that they haven't really, they're going over fractions right now, right? Because fractions are a lot of dosage calculations in medication administration. Hi, kitty. What's up? And anyway, so yeah, it's huge responsibility and an even bigger opportunity. I've been told, I don't know this for a fact because I have done no research on it. What do you want? How cute. What do you want? Hi, baby. That's Stella. She's so cute. She always has the puffiest tail. She was playing with the squirrels when I came home. Oh, up. There you go. And the squirrels are so cute when they get around her. She's always loved squirrels, and they're always kind of just little friends. It's cute. Anyway, so I stayed for an hour and a half after class to do tutoring on dosage calculations to help my students, and they were super appreciative of it. And and then I stayed even longer to work on, we haven't uploaded the schedule yet because it wasn't quite finished, and so I have to, I think they changed books or something, so I have to go in and just look at the curriculum. Our students have they have modules up. It's all online. Their book is online. They use a Apple Pencil. They have no paper. They're not supposed to get any paper. And I was a paper learner, so that's been interesting. And I did post their points breakdown. I found that information because I've been filling in the missing pieces, and also I will be designing the edits for the course based on the recommendations and expectations of our dean, right? Because she wants to create the best. So I'm doing that as well. So it's super challenging. And I don't know if I remember, I don't know that I said this, but I think I was in the middle of saying this, and then I was like, oh, squirrel, what's up? But to go back to what I was just saying about opportunities, I have been told that most new instructors do not get to teach a didactic class their first semester, and I do. So I just feel such tremendous gratitude to work with leaders who see potential in me and are providing opportunities for me to grow and reach that potential, right? I have mentors, there and at other places, but it's just to have the support of leadership and the encouragement of leadership to be in charge of a whole class, teaching a 1-hour didactic class and a 2-hour lab for such an important topic I just feel super overwhelmed with gratitude, and I don't want to let them down. So I don't want to let my students down. So it's cool. It's really cool. We've already started talking about how we are going to communicate in class, because it's really hard in the field to talk to doctors and to other professionals and be able to advocate for yourself and for your patient. And I feel to give them the best chance at being super successful, even more super successful than they would be without this aspect. I've told them that we will, in class, where I expect them to ask questions like they would if they were in the field. So you have to find the right time to interject your questions, use verbiage, and language is a whole other language. So when they ask questions, they're supposed to lead with, I have a clarifying question. And then we, talk about the question, we clarify the information, and then You know, they repeat back what they heard me say, and I close that loop of communication by affirming that what they think I said is what I said. And that's super important in nursing. And so we're starting it now. And, you know, I've told them if we have a conversation, like one-on-one, like, you know, you should go ahead and like send me an email based and, you know, just confirming our conversation, confirming what you understood from it. And, you know, like just you have that record, right? So I'm excited to be able to implement these like new ideas that I just kind of came up with. Like if I could just get paid for my ideas, I mean, I feel like I'd have a lot of money, but I don't just get paid for my ideas. I have lots of ideas. I just need people to do it. So anyway, I'm excited, and yeah, it's going to be really good. And we're going to make really good students, and I will take any tips and tricks that you all have. If you're an educator, like resources, what has worked for you, what has not worked for you, you know, games, like anything that you have to offer about education. Like I do not have a degree in education. I have a degree in business, and I have a degree in nursing. I have a bachelor's degree. I have an associate's degree in nursing and a bachelor's degree in nursing. Stella. And but I do not have a degree in education, and I have not really educated people outside of just for fun, because that's what I do anyway. So for those of you who are strong and have those skills, I mean, please, like resources, send them my way, please. All of it, send it all to me. I'm like a sponge, and I already know that I'm gonna work so many more hours than I'm gonna get paid for, but it's okay, because I needed a change, and I needed an opportunity to grow, and I have it. God always provides. So super blessed. Anyway, that's it. I'm sorry that my video is kind of all over the place and that my eyes are all over the place, because I don't want to look at myself, but I want you to feel like we're having a conversation. And I also should probably critique myself so that I'm not like, every 5 minutes. So, yeah. Tomorrow I have a couple interviews, and then, because I'm just PRN at the college, and I'm part-time at the college, so I can work like 25 hours and get paid for those. And then I'm PRN at the hospital, and I like to just have lots of opportunities in case I need them. So I have a couple interviews, and I'm probably going to try to kayak tomorrow. And then Thursday, and then work on a lot of this course stuff too. And then Thursday I'll have office, and then like class, and then I don't have to go back to be a nurse at the hospital until next Monday. And I'm like so grateful, because I just need to like decompress. So anyway, that's it. I'm a college teacher. They call me Professor B. I had to ask the dean, like, what do you want the students to call me? And she says, Professor. And I said, are you sure? Because do I need to earn some credentials for that? Like, I don't want to like be telling them to call me this, because somebody told me to tell them to call me this, but I don't want to be, you know, accepting a such a prestigious, in my mind, prestigious title if I haven't earned it. And I did do the research to make sure that like I didn't need certain credentials to reach this. But that's, I guess, at the college level, a lot of colleges, they agree on what they want their instructors to be called, and this college they want their instructors to be called professor. So my students call me either Professor Beck or Professor B, which is interesting to accept, right? I've always just been Moriya, or Miss Moriya, or Hey You. So it's interesting to have that new, like, just that new title. I don't know if it's a title or whatever it is, but it's interesting. And then I just want to live up to it. And also, the college has, they want me to get my master's, and they're willing to pay for it. I don't have that in writing yet, so I want to believe it, but I am kind of the type of person that doesn't really believe it until like I see it happen, especially when it comes from the mouth of other people. I just know that that's like, you can say all you want, but until you do it, like it's still just talk, right? So I'm really excited because I have to decide like what do I want to get my master's in. I mean, obviously, like a master's of science in nursing, but I can get a dual MSN and MBA, right? Like, how rad would that be? I mean, I already have a bachelor's of business administration, bachelor in science and business administration, and a bachelor of science in nursing. So, how rad would it be to have like an MSN, master's of science in nursing in whatever like I choose the subfield to be, along with like a master's of business administration? Like, how many opportunities, like what world does that open? I don't know. There's a lot to think about, and what do I want to do? So if you have any like ideas about that, I'd totally be interested in that too, because I could do like master's of science in nursing in education, master's of science in nursing in leadership, master's of science in nursing in informatics. There's a lot. There's like a lot of things I could do. Nurse practitioner route if I wanted to. So got to do my research, figure out what I want to do. So I just have to get really good at my job so that they want to pay for that, because I would love that. Anyway, okay, that's it. I'm done talking. I want to eat. I want to feed my cats. I'm going to take a bath, and then I have to work on the schedule a little bit before I go to bed. So thanks for your time and attention. And I'm sorry if it's too long. You can silently or privately tell me if you feel like I need to change my video blogs. Just be nice, please, because I need kindness and lots of it. So yep, that's it. Feel free to drop a video response. Like, I think that'd be rad. Anyway, I love you guys. I feel really blessed right now. I feel like I'm coming back to be myself, and it feels really good because it's been a while. So, all right. Bye. Mwah. Cheers. Molly and Stella say, night night, kitty kitties. Night night, night night. Night night, kitty. Bye.